Good evening. What's up? What's up? What's up? Hello out there in Facebook land. Hi, I am Dr. Mitzi Williams, and I am your board certified neurologist. Specializes in multiple sclerosis and has various interests, including increasing diversity in clinical trials, as well as doing research with African Americans in MS. For those that don't know, I am also a huge music buff and a music fan. I'm a singer, and so I always like to start my live stream with what I'm listening to. So currently I am listening to a new album called Hive Mind by The Internet. I really like The Internet. So I've been waiting a long time for them to come out with a new project. So I really do like the new project. So if you like kind of neo soul funky music, you should check it out. So Hive Mind by The Internet. So anyway, I hope that everyone is doing great this evening. I'm going to go ahead and get started. I don't have a whole lot to talk about this evening. I am going to talk about diagnosis of MS, but first, just some thoughts. This has been a whirlwind of a week, and for those of you who follow me and have been looking at my page, tomorrow is my birthday. I've got a big birthday coming up tomorrow that I'm very excited about. And so I've just been reflecting today on what it means to enter a new decade of life and kind of what's important. I think, when you enter a new decade, it really causes you to reevaluate what's important to you. And so I am more and more recognizing that it is the relationships that are most important to me. I have so many wonderful people who are part of my tribe. I have great family, I have great support, I have great friends, I have an amazing husband, and I have pretty cool kids, if you ask me. So I'm just really blessed and really excited about the next phase of life and about celebrating another year. I'm very grateful for that. And just excited about all the wonderful things that are going to be coming up in terms of my research and the things I'm interested in with MS. So I am, as I said, a board certified neurologist, and I work in the field of multiple sclerosis, which is a chronic neurologic disease that is the second most common disabler of young people aside from motor vehicle accidents. So I want to talk a little bit about diagnosis, because sometimes people wonder, and I actually had somebody inbox me after looking at one of my Facebook's lives and ask me, how do I know if I have MS? How do I know if I have symptoms of MS? One of the difficult things about MS, or one of the challenges, is that the symptoms are very common symptoms to other diseases. For instance, if someone has tingling in their hand, tingling in the hand can come from a variety of different diseases like carpal tunnel syndrome, or sometimes if someone has degenerative disease or arthritis in their neck, that could cause them to have symptoms of numbness in the hand. But MS can also cause that. Other symptoms that are very common are if people have, for instance, problems with their bladder. Maybe they have to go to the restroom pretty frequently. We call that frequency. Well, if you're a woman and you've had several babies, then that certainly can make you have to go to the bathroom all the time. So all of that to say that sometimes there are very common symptoms that could be attributed to other things. So oftentimes people will have symptoms but maybe push them off because they think they're due to something else, and eventually you go to the doctor and they put everything together and they say, oh, this looks like MS. So when we talk about diagnosis, again, it is a disease that affects the central nervous system, which is the brain, the spinal cord, and the optic nerve. So some of the most common symptoms that people present or start out with are things like vision problems. So sometimes people will have difficulty with their vision. They may not be able to see out of one eye, or sometimes they may have decreased color vision. Sometimes people will also have double vision. So if you ever have symptoms like that, it's always important to immediately go to your doctor and get checked out. And oftentimes, actually, the eye doctors are the ones that refer patients to me as a neurologist because they suspect MS. So if there are visual changes, that certainly is a reason to get evaluated. Other more common symptoms are sometimes symptoms that are similar to stroke. So someone will have numbness on one side of their body. They may have numbness in both of their arms. They may have numbness from the waist down. So if they have symptoms like that, then again, it's important to go to the doctor to get checked out. And so again, if you have neurologic symptoms, new neurologic symptoms, vision changes, numbness and tingling on one side of the body, numbness and tingling from the waist down. Those are all reasons to possibly go be evaluated. MS commonly is diagnosed in people who are between the ages of 20 and 40, or kind of 20s to 50s. People can be diagnosed outside of that range, but that's a very common age range for people to be diagnosed. And also, often my patients are very healthy before they're diagnosed. So you don't necessarily have to be very sick or have other chronic illnesses to be diagnosed with MS. Oftentimes, my patients have never had any other medical problems before they present with their symptoms of MS. So how is diagnosis made? So there are a couple of things that we do to diagnose a person with MS. First, hopefully you see a doctor and they examine you. Okay, so the history is very important because sometimes if you're talking with somebody and you start to think about it, you may say, oh, you know what? After I had my first child, I had this episode of numbness in my leg, and it lasted a couple weeks and went away, and we just thought it was due to having the baby, you know. So sometimes when you're speaking with someone and when you're talking with the doctor about it, you may remember symptoms that you had that went away that you may have thought were related to something else. So history is very important. A physical exam. Physical exam is also very important because sometimes there will be subtle signs that there's been damage to your nervous system that you may not notice on a regular basis. So for instance, we have people do tests where they touch their nose, touch their finger, touch their nose and then touch the physician's finger. If we see changes in that or we see other changes on exam, it may tell us that there are subtle things that may have occurred, that point us back to maybe something that happened in the central nervous system that's causing the symptoms that you're having. So a physical and exam are kind of the first place to start. Hey Vivian, hey Auntie Weena. And so the other things is that there's some tests that we do to see if there is other evidence of multiple sclerosis. So you see the doctor, you get a physical, you get a history, a physical exam. Other tests that we do include MRIs. So MRIs are extremely important to diagnosing MS because they basically show us the areas of damage where the immune system has attacked those parts of the brain or spinal cord. So normally what we're looking for are white spots on the MRIs. The white spots are areas where the coating of the nerves has been removed, and that's why they show up white. Normally they will be gray, but they show up white, meaning there's been some damage that's been done in those areas. So MRIs are extremely important. They help us diagnose, and oftentimes your doctor may do an MRI of your brain, and they also may do one of your spine, depending on what the symptoms are and depending on what your physical exam looks like when you go to be evaluated. So we do MRIs. Other tests that may be done are spinal taps. Nobody likes spinal taps. And I always ask my patients, if I say, have you ever had a spinal tap? And they say, I don't know, then the answer is you didn't have one. Because if you had one, you definitely would remember it and you probably would never want one again. But spinal taps are kind of like epidurals for people who have not had them. It's kind of like an epidural, which is the same procedure where they give anesthesia when someone's having a baby. But instead of giving you medicine to make you numb, they basically take some of the fluid, the spinal fluid out and send it to a lab, and that tells us if some of the markers there that are typical of MS are there in the spinal fluid. The spinal fluid can also tell us if there are signs of infection or other type of disease processes that are going on. Spinal taps are not mandatory, so they don't have to be done to diagnose MS, but sometimes they are routinely done. It's kind of like icing on the cake, right? So the MRI can give us a lot of information, but the spinal tap can give us additional information if it's positive. Even though the majority of people with MS do have a positive spinal tap, a negative spinal tap by itself doesn't necessarily mean you don't have it, okay? So it's important to follow up with the doctor and kind of put all of those things together. Other tests that we do sometimes there are other tests we can do to look at the way that the peripheral nerves work. There are other tests that we can do to see if there are blockages in the signal from the nerve messages going from the arms or the legs up to the brain or up to the spinal cord and back. So there's several other tests, but the main ones are the MRIs and the spinal taps. So that kind of tells us about diagnosis of MS. So the interesting thing about the criteria or the diagnostic criteria that we use to determine if somebody has MS is that it really has changed over time. So if you look at the treatment of MS, we have a lot more treatments than we had in the past. And so essentially, when we had diagnostic criteria, let's say 20 years ago, what we used to do was if you had a symptom and we thought it may have been MS, we would say, okay, well, we'll wait until something else happens. And then when that second thing happens, then we'll consider starting treatment, because we didn't have very many treatments at the time. And sometimes, before 1993, we didn't have any treatments. So now, as the criteria changes over time, we're diagnosing people earlier and earlier, because we know that the earlier we start treatment, generally the better people do over time. And also, the more we can try to prevent disability if we start treatment very early. So now the way we diagnose MS is that basically if you have a symptom that looks like MS, if you had 2 episodes of symptoms that are typical of MS, and you have 2 different findings on your exam that look like MS, that can diagnose it by itself. But generally we include the MRI. So if you've had one attack and then you have several areas on your MRI, some that look old and some that look new, that are spread out in different parts of the brain, we can diagnose MS on the spot. Okay, so it's very important that as soon as you have those symptoms, you see a neurologist, but then after that to make sure that you follow up so that they can determine if they think this is MS or if they think something else is going on. Also, if someone presents with symptoms of possible MS, there are blood tests that we do. So there are some other diseases that can mimic MS and sometimes also cause white spots in the brain. So there are some people who have lupus who may have white spots in the brain that could be confused with MS. Also, some people may have sarcoidosis, which is a disease that affects the lungs but can also affect the brain and cause neurosarcoid, and that can also be confused with MS. And there are other rheumatologic diseases that can have some of the same types of symptoms. So if someone has symptoms of MS and maybe has a normal MRI, then we may go looking for other diseases to see if that person maybe has something else that is in the autoimmune family, but not necessarily MS. And then one other important thing is that autoimmune diseases can sometimes run in families, but can also sometimes run in the same person. So someone can have multiple sclerosis, but they also can have another autoimmune disease like lupus. So I have some patients that have lupus and MS. I have some patients that have rheumatoid arthritis and MS. And then I also have some patients that have certain types of autoimmune thyroid diseases and also have MS. So it's just very important if you're having different symptoms or new symptoms to make sure that you're keeping up with your doctor to determine if there are any other things that need to be treated or if there are any other physicians such as rheumatologists that need to be seen. So those are some of the most common ways that MS presents, meaning the first symptoms that people have. That's how we diagnose it. We do a history to find out if you had multiple symptoms. We do a physical exam to see if there are signs there that there may have been damage to your brain or your spinal cord that may be very subtle and you may not notice on a daily basis. We also do MRIs, which show us those white spots. And one more thing about white spots, all white spots are not MS. So sometimes we can see white spots due to headaches. Sometimes we can also see white spots if people have had a previous stroke. Or we can see white spots if people have symptoms of cardiovascular disease like smoking, diabetes, or uncontrolled hypertension. So just because we see the white spots doesn't mean it's MS, but they're white spots that need to be in certain locations for us to feel more confident that it's MS. So history, physical, MRI, spinal tap. In some cases, it's not done across the board like we used to do. So that's good for people who, don't necessarily have to experience that. But that gives us extra information. And then we do blood tests to rule out other diseases that mimic MS. And then sometimes there are other tests that we do to test the peripheral nerve to make sure that, for instance, it's not something like carpal tunnel or some type of neuropathy that's causing the symptoms that someone has. So that's how we diagnose it. So if you have any of those symptoms, feel free to talk to your doctor and get it checked out. And hopefully, if the diagnosis is MS and you're pointed in the right direction. There are many great neurologists, many great general neurologists that treat MS, but there are also specialty centers such as the one that I work at that also treat a lot of MS. So anyway, thank you guys so much for your time and for your attention. I hope that everybody learned something today. Please share my video. And if you don't follow me on social media, please follow me at Dr. Mitzi Joy MD on my social media handles. I'm on Instagram, Facebook, Twitter. I'm on Pinterest. I'm on Google Plus, and that's Dr. Mitzi Joy MD, DrMitziJoimD. And please feel free to follow me and share the video. And if you have anybody that needs the information, please feel free to share it with them. So I hope everybody has an amazing and wonderful night. And I'm going to get ready to celebrate my big birthday tomorrow. And I hope that you all have a great day. All right. Good evening, and you guys have a great one.